Chapter 12, Word Analysis and Communication. In this lecture, we're going to be focusing on word analysis and definitions for words involving with medical terminology. Now, looking here, we have these elements of identification. So we previously already discussed this in chapter 1 regarding suffixes, roots, and prefixes. Now we want to look at the analysis. When analyzing the meaning of a medical term, breaking it down into elements is key. Here are the step-by-step process. First, identify the suffix. What is a suffix? The suffix often provides clue about the term's function, such as condition, procedure, or specialty. Next, identify the root. The root is the core meaning of the term. Be mindful of any combining vowels that we may have connected the words roots to the suffix. Then identify the prefix. If the word has a prefix, it modifies or specifies the meaning further. Finally, analyze the word. Combine the meaning of the prefix, root, and suffix. Together, they reveal the full definition of the term. So here, let's break it down. Right now, we have this term endocarditis. So the suffix is itis, which means inflammation. Root is card, which refers to the heart. The prefix is endo, which means inner or within. When you combine these meanings, endocarditis, right? So endo meaning inner, card referring to the heart, itis meaning inflammation. This term can be broken down into what is called inflammation of the inner lining of the heart. More word analysis. So let's define the term endocarditis step by step. And let's try to make this as interactive as possible. So if you want, freeze your video and try to do this on your own. If not, you can follow along. So again, we're starting with the suffix itis, which means inflammation of. Next, identify the prefix, which is endo, referring to inner or within. Finally, identify the root, which is card, which refers to the heart. Okay, putting it all together, endocarditis, meaning inflammation of the inner lining of the heart. Plurals and pronunciations. Here, one thing to understand is that understanding plural endings in medical terminology can be challenging because they are not based on the English language. Plural forms are rooted in Latin and Greek, unlike in English, where adding an S typically makes a word plural. Medical terms follow the rules of their original language. To correctly form plurals, student must learn to memorize the specific rules for medical terms derived from Latin and Greek bases. Examples. You have atrium, which is singular, becomes atria, which is plural. Diagnosis is singular. Diagnoses is going to become plural. Okay. And again, like I said, these have Latin and Greek origin, so they're not necessarily used with the conventional English language. Vertebra is singular versus vertebrae is plural. So one thing to look at is it's not really related to the English language of just adding a simple S. Depending on the term, depending on the ending, you must modify it accordingly relative to the rules. More examples that we can practice. So let's focus on the plural endings of these medical terms, which can be quite different from the singular endings, right? And here in your chapter 2, specifically table 2.1, you have sort of a comprehensive list of very common suffixes and their plural form. So for this lecture, we can focus only on these ones I provided. All right. Now, very simple examples. If you have singular axe, it changes to aces. So for example, thorax becomes thoraces. The singular changes to a, which is, for example, bacterium becomes bacteria. Singular is changes to is, which is going to be referred to diagnosis becoming diagnoses. All right. So on the slide here, I provided for you axilla versus axillae. So axilla is singular, axillae is plural, right? And from our previous example, ax is going to be singular versus aces is going to be referred to plural. So thorax versus thoraces. Precision in communication. So precision in communication is both written and verbal communication is one of the most critical skills for healthcare professionals. Here's why attention to detail is so essential. Example, we have hypotension and hypertension. Two terminologies that are slightly different than when they're written, but can mean completely different definitions. So examples, hypotension, you have the suffix, which is the prefix is basically, so the suffix and the root is the same. What changes between these terminologies is the prefix. So looking here, you have hypotension referring to low blood pressure versus hypertension is referred to as high blood pressure. Okay. Now, by understanding medical terms deeply, you ensure precision in communication and contribute to safer patient care. If you mix these terminologies, what can happen? Incorrect diagnosis, incorrect treatment, and this can actually cause detrimental problems to the healthcare community and also the patient. Always be prepared to double check or clarify when something doesn't fit. It could prevent a serious error, right? So one of the number one causes of death in the hospitals is actually human error. And that's why precision in communication, pronunciation, understanding the different rules for the words are so important in order to have the most highest form of patient care.